So all of you are worried about your upcoming NEET PG exam and FMG exam. So I thought who better than Dr. Surya Kumar to help you with the microbiology. Sir, first question. Please tell me, sir, you are considered the best faculty of microbiology in the country.
Thank you, sir.
Why it is so?
So because we are teaching crisp, what is the need for the student we are teaching, not what given all textbook we are not teaching, and 99 to 100% strike rate from our teaching. So because of that, people consider this actually.
Sir, any idea, like if I am a FMG aspirant, so what should I study for the upcoming FMG exam? Give some tips. I want to pass, sir. Please help me.
First, consider the subject is not a tough one. Read lot of one-liners, especially culture media, colony morphology, some important clues, named diseases, stepladder fever, like that you need to know, and latest updates, Nipah virus outbreak came, like that latest updates you need to do, and something about vaccines. Those things you need to concentrate, mainly one-liners without panicity, you will succeed.
Sir, some more details, sir, like because many of our listeners will have an exam very shortly. So they may not have, like consider somebody who has not studied microbiology. Can you tell them in detail some few points that they need to remember at least about vaccines?
For every vaccine, you should have a template. First, name of the vaccine.
Okay.
Second, what is the purpose we are giving. Third, what is the schedule they are giving. And what is it contains, live, killed, attenuated, antigen, what it contains. And how they store and mode of injection. And finally, any important contraindication is there. That's all. So you make a template like this, all vaccines you put, like that every organism you have a template. Based on the template, you just fill the things actually, easy to revise, easy to read, easy to remember, easy to reproduce.
And what about this March NEET PG exam? Any tips for the NEET PG aspirants regarding microbiology?
Yes, NEET PG aspirant should read all the important clinical scenarios. They should attend all the GT and CBT. It gives a real experience. Everybody is reading. Only the people who practice, they will win. They should have the real situation, how the exam should be. Before that, they know the difficulty. Exam is not a place to do your final settlement. Here you do a lot of mistakes and learn from the errors and rectify, and you rock in the exam.
Sir, any particular new update in microbiology that you think is likely to be asked in maybe central exams, like that mRNA vaccine, the Nobel Prize, anything that you want to tell?
Latest mode of diagnosis they are asking, RT-PCR, like that, any latest mode of...
anything you can predict.
And they may ask about latest vaccines, because India introduced many vaccines first time in the world. They are not introduced any part of the world, only in India, 4 or 5 vaccines they introduced. Definitely we may expect, because that is achievement of our country. We may expect
which one, sir?
For example, first COVID vaccine, plasmid vaccine, DNA vaccine, India, Zygo D. First inhalational flu vaccine from India, that is called Nasavac. First COVID inhalational vaccine from India, that is called Incovac. And first rabies G protein vaccine, just a 3-dose vaccine, Trabis from India. These are all first from India. So we may expect some questions came from that kind of area, because it is not regulated. And some case definitions, for example, measles, previously we say CCC, cough, coryza conjunctivitis. Now the measles case definitions, just a fever with rash. Those kind of updates we need to implement.
So take care of the updates, take care of what is coming out from India and the new vaccines. And don't forget, all the exams are doable provided you practice enough tests. So final tips from you, Dr. Surya. Dr. Surya, how do you keep yourself motivated?
First of all, we should love the subject. Second, any subject is not much easy. Some mistakes we need to do. Those mistakes we need to correct by repeated practice, repeated practice, repeated practice. That's all. And read in a systematic way. Don't read bulk amount. Read concise, creep, what is needed, and you need to remember that, with understand the concept. That is the ideal way. Instead of that reading this much bulk, you have the satisfaction of reading this much. You cannot remember, you cannot recollect anything. Many students are doing the mistake. I say it's a mistake, because if you want to write a university exam, you can read bulk. This is a competitive exam. You want to know one-liners, important crisp points. So that is choose the correct material, correct weapon, then only you can win the battle.
And Dr. Surya is known for 2 things. One, his crisp, concise teaching, and second, his punctuality. If you ask him to start his class at 2 p.m., at 1:59 he will be there in the classroom. So any advice regarding time and punctuality for the youngsters?
Definitely. You practice time, punctuality for at least next 3 months. You know the difference. You got transformed without your knowledge. And after 3 months, you think definitely your level of learning, many things you will change. Only you can feel it. You follow from today. After 3 months later, if you didn't have any change, you let me know. Okay? Definitely it's there. Only you can feel. Practice it. No money, nothing. Just to practice punctuality for next 3 months. Definitely you transform some level better than what you are now.
So if you, final words from Dr. Suria, if you value your time, then the world will value you. If you don't value your time, nothing will happen. And in the end, Dr. Suria, I want you to, complete our slogan with us. Apna time, apun khud layega.
Apun khud layega. Apna time, apun khud layega. Because I don't know that slogan. I know apna time aayega. Apna time, apun khud aayega.
Thank you. अपना टाइम आएगा मीन्स कि शायद कोई जादू से आ जाएगा, अपन खुद लाएगा, मतलब अपने आप लाना पड़ेगा. Wish you all the best. Keep rocking. Look forward to meeting more of you on this series on the YouTube.
Thank you.